Hi, my name is Mahalit, and today I'll be showing you how we can administer eye drops on the patients. So the first thing I do before I head to the patient's room is I'll verify the doctor's order and verify the six rights of medication, right patient, right drug, dose, time, and route, and documentation. And then I'll check my medication order and the electronic health record as well. After that, I will be calculating the dose if I have any dose to calculate for my medication, and I'm gonna go to the patient now. And I have my medication and my gloves here. Knock, knock, knock. May I come in?
Come on in.
Hi, how are you?
I'm doing great.
My name is Mahalit, and I'll be your nurse today. Is that okay?
Yeah.
Okay, perfect. I'm gonna put my medication on the bedside, and I'll provide privacy. And I'm gonna go ahead and identify my patient using two identifiers. I'm gonna ask my patient to state their name and date of birth. Can you please tell me your name and date of birth? And I'm gonna check at the same time I ask him. I'm gonna be checking on the wristband. Go ahead.
Tad Almu Martinez.
Date of birth. Okay, thank you very much. And after that, I'll ask the patient if they have any. Do you have any allergy, any food allergy, medication, or any seasonal allergies?
No.
Okay. Okay, perfect. And then I'm gonna let my patient know the purpose of my visit. So I'm here to give your eye drops, and this eye drop will help you to reduce a pressure on the eye. And you might also experience a burning sensation, a stinging on the eyes. But if that worsen and if you feel like you have something on your eye, if you feel like there's something giving too much pressure on your eye, if you feel headache and any kind of that side effects, please let us know, and we'll let the physician or we'll notify the physician as well. Okay?
All right.
Perfect. Do you have any questions for me?
No.
Okay. No questions?
No.
Okay. I will allow my patient if they have any questions. If they don't have any questions, I'll make sure that they're sitting in a comfortable position. If they want it like supine or like sit up. So are you in a comfortable position?
Yes, sir.
And if I need to put the side wheels down, I will put the side wheels down. I'm just gonna adjust my camera. So what I'm going to do is I'm going to go ahead and perform hand hygiene and put my gloves, and I'm going to clean my patient's eye. And I have, let's say I have my soaked warm wash rug, and when I clean my patient's eye, I make sure I clean it from inside outside, from the inner canthus to the outer. I'm going to do the same thing, inner, outer. So inner, outer, not outer from the inner. We make sure we do it from the inside to outside, inside to outside. And then I'm just going to go ahead and dry it. And after I clean the eye, I'm just going to go ahead and take off my gloves. And then I'm going to wash my hands and reapply new gloves. Okay, I'm going to wash my hand and I'm going to go ahead and apply a new glove. Oh, you're tired?
I'm sleepy.
Oh, we're almost done. While you're doing this process, just make sure your patient is comfortable, engage conversation. Okay, now it's time to put the eye drops. What I'm gonna do is, like I have my cotton here, I make sure I have this and my clean tissue, and I'm gonna go ahead and put this under the bone, like the orbit bone, and then I can use my finger up. And make sure I put it like this. Hold it. Not too much pressure, like very gently. We don't need to push any, we don't need to put any more pressure on the eye. Let me just kind of fix my camera so you can see. So make sure you never press the patient's eyeball. You always want it to push right here at the bone orbital. Put it down. The reason we do this is that way it will give us it will expose the conjunctival sac. That's where we need to put the prescribed number of drops. So it says 1 drop twice a day. So I'm gonna do 1 drop, and I'm gonna do the same thing for the other one. So we make sure this doesn't touch any of the like the eyelid or any drop. And then if the patient, let's say after as soon as I put the patient eye drop, patient might blink. So if they blink, we make sure we clean it and apply the medication, reapply the eye drops. And after that, we can apply a gentle pressure to the nasoclinal duct, like a very gentle, about 30 to 60 seconds for each eye after applying. And then we make sure our patient is comfortable after we apply. Ask them, oh, do you have any burning sensation or anything?
No.
Okay, very good. And then after that, we make sure we put the patient back to their like comfortable position, and no, we will ask them, and then after that we'll just dispose the things we use, and then remove my gloves and wash my hands. And then after I finish this, okay, is there anything you want me to get you or anything you want me to do?
No, not at this moment.
Okay, thank you. So I'll make sure I give the call bell within reach, and I will undo privacy, wash my hands, and leave the room. I'm sorry, my screen went off. Leave the room and do my right documentation. Thank you very much.